helping those in need. Next, On Call with the Prairie Doc.
Good evening and welcome to On Call with the Prairie Doc. We're departing from our usual show to highlight an educational project involving some of the volunteers from our On Call with the Prairie Doc pre-med students and pre-professional students. Behind the scene each week we have a group of dedicated students who help us by answering the phone calls of you, our viewers, and these students had voiced an interest in seeing something other than American medicine. Well, we were fortunate to tie in with another group who have a long-standing practice of helping the people of rural Nicaragua. Tonight, we'll talk with some of the students involved in this trip, as well as show you video of our experience. And now for tonight's Prairie Doc quiz question. The percentage of Nicaraguan population that's over the age of 65. A, 20%, B, 10%, C, less than 5%, over 65 years of age. You have the entire show to think of the answer, and we'll announce the correct answer at the end of the show, although you can't call in the answer because this is pre-recorded. Tonight we are joined by Joanie Holm, who is the Vice President of Healing Words Foundation, a certified nurse practitioner and married to me. She's also leading the Healing Words Foundation's mission trip to Nicaragua. And Tori Bishop, who is a pre-med student, also went on the mission trip. Thank you both for joining us. Throughout tonight, I will be joined by others who were part of the mission trip. So Tori, tell us, you're from where, Tori?
I'm from Sioux City, Iowa.
So, and you're a sophomore?
Yep, sophomore biology pre-med student.
So pre-med. So you decided to go into medical school, to shoot for that goal. When? How old were you? What were you doing?
I was always kind of interested in medicine ever since I was very young, and then I think just recently, probably about 3 years ago, I just really decided that that was the best place for me.
And you've come to SDSU to get your training.
Yes, exactly.
And so, and the opportunity to go to Nicaragua came upon you. What made you decide to go to that trip?
I had already been to Haiti the year before I went to Nicaragua, and I loved it. And so to be able to experience that mission trip and then be able to incorporate medicine, which is what I love, into the trip as well, it just really made it an exciting experience and definitely something I didn't want to pass up.
So Joanie, your reason to organize this, because you're the one who really put it together, what were your expectations?
Well, I just hoped that the students would have an exposure to something other than what they can see here. The students in undergraduate school get some experience to shadow, but they don't get a lot of chance to do hands-on. And so by taking them out of the country, there was advantages to exposing them to a different culture, but also to maybe do something different in medicine that they wouldn't normally be doing here in the United States.
And really seeing different kinds of illnesses than we have here.
Right.
So Nicaragua, how poor is Nicaragua, or how tough is it there for people?
It's a very poor country. I don't remember where it rates in the list of countries, but it's one of the poorer countries. And it was interesting, I think, the dichotomy of the cities that seemed quite
normal.
Yes, it's with cars and tall buildings and electricity, and then the rural villages where we would go every day that were very poor and didn't have medical clinics, and I don't know that, well, I know they didn't have adequate water, and so I think adequate food was also an issue.
Yeah. Tori, what was your first thoughts as you arrived there? A little trepidation?
Yeah, it was definitely different than here. I think having the background in Haiti that I was able to have, it didn't make it so much of a culture shock, but it was still obviously so much different than here. And
how about difference from Haiti? Show us the parallels there. Or the comparisons.
I would almost go as far as to say that Haiti was a little bit more rugged and a little worse off especially I think because we got to see a lot of the nicer areas of Nicaragua. I think that made a difference, but definitely Nicaragua was still, there's a lot of areas that were really in rough shape, yeah.
Yeah. You're a pediatric nurse practitioner, so you know what healthcare is all about. Overall, how is the healthcare there compared to what we have here?
The structure of the health care was quite different because they don't have the clinics that we have. The health of the people, the health of the children was quite good, you know, as far as what we saw. I mean, I think you're looking at a population who are outside, they're active, they're playing. The day-to-day child, they're as healthy as our kids. They just don't have the infrastructure and the ability to go in to get checked and to have some of the care that we have. Now, maybe that's not all bad. Sometimes I think that we need to listen to our mothers and our grandmothers and learn about health care, and I think sometimes the families in Nicaragua probably did that.
It strikes me, one time I went on a skiing trip. It was a medical education thing, and we were hanging with all these little kids, and the kids were bratty and miserable. And at the same time, some friends came back from Haiti, and they had been commenting about how happy the children were and how, you know, how life was good for them. They were wonderfully happy. Did you sense that happiness in the children was?
Oh, definitely. Yeah, I think the big thing is that they aren't given very much, and so what they are given, they just appreciate in tenfold compared to kids here, because they just aren't used to being given things, anything. Yes, we brought a ball with us to Nicaragua, and they just, it was
crazy.
Yeah, exactly. We just played for hours and hours and had so much fun, and they just appreciated everything. They appreciated every second we gave to them, because you could tell that, like, they just didn't get that as often.
Yeah. Now, the illnesses, you saw illnesses there in children in particular. What did you see? A lot of illness of any
saw
particular?
Children and adults. I spent time with children, but the students spent as much time with adults. There were people that would come to the clinics, and they came with very common complaints, and mostly often they wanted medications because they didn't have access to medications. And they knew that with Dr. Shook that he brought medications in. In fact, that's what the students worked on quite a bit, was organizing the medications. So they might come with really simple needs, parasites that may not be so simple, we're not used to it, but they weren't acutely ill. They just knew that they could get some medicine to help them with their parasites. So they didn't look real ill, the students, or the children or the adults that came, but they did have needs.
They had medical needs.
Anemia, you know, vitamins were important.
Did you have a chance to do much lab work?
We didn't do any.
No.
No
It was
lab
all
work.
just
No
the
lab work.
pharmacy.
And of course,
yeah.
I wonder how up-to-date their electronic medical record is there. Was that a joke? That was a joke.
I never really asked anybody that was in the hospitals. I don't know.
Did you, tell me about where you went. I mean, I think you were there, what, 10 days? And so you lived in the city, right? And then you traveled during the day to rural villages, or
Yes,
what?
but we moved different locations each night, basically. So we landed in Managua, the capital, but then we would go a day trip and set up a clinic, and then we'd stay close by wherever that little town was. And we stayed in nice facilities that Dr. Shook had organized, usually hotels, and we stayed in one. It was a resort area that a lot of weddings occurred in, but they were just a place to sleep, and then during the day we would go set up to the next village.
Now, was it in a jungle kind of a atmosphere?
One of the days that we spent, the resort, it was like a resort in Nicaragua, and it was like a jungle, and it was
the
beautiful.
jungle.
Yeah,
It was.
And very beautiful.
very, yeah.
Right, very tropical, very warm.
Safe?
Yes.
Yeah. Yeah.
I mean, we were careful. We didn't go out alone, but we never feared when, particularly in the cities, we would go out at night. And in fact, there's a story. We were talking about stories earlier. Dr. Shook just insisted that we go to a dance. I don't know what we'd call it. So all the students and I
went
went
dancing?
to
Dancing, yeah.
So let's hear about that, Tori.
It was fun. It was definitely interesting.
Rock and roll or?
No, not quite. More like, what do you call it? Like
Rumba,
salsa,
like
kind of.
salsa.
Yeah.
Yeah.
It was a good time, and they showed us how to do it, and a lot of hip moving, and yeah, it was fun.
So you had fun while you at the same
most
time as the
definitely.
work.
Oh yeah.
So what were the clinics like? I mean, what did the clinics look like?
Honestly, they were like little tables, and we would just like bring our boxes full of medicine, and we would count them out and just label the different prescriptions, and then once the doctors would be able to fill out those prescriptions, they would hand it to us, and then we would find the correct medications and just fill up a little baggie for them.
So this was in varied places. I mean, little rooms, little hospitals, little buildings.
They were
outside?
basically either a home, or one time it was a church, but we just used I guess we used the whole church.
Yeah.
Every day was a different location, but they were very humble, pretty empty, and they would set up some tables, and if we separate ourselves, the providers would be separated so that we wouldn't be all on top of each other, and then the students would have a place with the pharmacy.
So, I mean, you had a kind of an expectation of what it was going to be with, since you'd been to Haiti. Did it fulfill those expectations? What did you find happened as a result of it? What was the experience compared to the expectation?
I think it was pretty much what I expected to an extent. And again, like you said, I think Haiti contributed to that. But I definitely had a lot more fun than I thought. Like, we got to see a lot more places than what I anticipated being able to see. Traveling was really cool, and just the whole experience, it was honestly even better than what I expected. So it was a great time.
And Joanie, for you?
It was a great trip. It was great being with the students. I had a bonus that our daughter went along, and our niece went along. And our niece is fluent in Spanish, so she was contributed to the translating.
It was a totally Spanish-speaking experience.
Yes.
I mean, they didn't know a lot of English there.
No.
Really, we are spoiled because traveling in Europe, everybody spoke English almost, but they sure didn't there, huh?
No.
And so you had a couple interpreters.
Right, we had some people that could help, and with the medicine part, well, a lot of it was sign language, but we did have people that would sit with us and help explain what was going on with their health.
Right, how much of a barrier was that language issue?
Well, when you had a helper, it wasn't a problem. Without the helper, it would have been, without the translator.
For us, mostly the communication that we would have if we didn't have a translator would be playing with the kids.
Right.
And honestly, not having that language, or the language barrier wasn't so prominent just because we were just playing. Like, kids know the play language. You kick the ball, like, you don't need to have words for that. And just having fun, you don't necessarily need to have a language for fun. You just kind of go out and do it, yeah.
Play with the kids.
Yeah.
And they did just great. I mean, I wonder about our own kids. Have they lost the ability to play? I mean, they sit in front of their computers and their Game Boys and their, those types of things. Of course, they play in that manner.
I think they've lost a lot.
Yeah.
I think the children that we worked with in Nicaragua it's a different kind of play. It's healthy, climbing trees, running, a lot of laughter.
So that's a learning experience. I mean, you think about it. We have lost something here that they have there in a third world country.
Definitely.
Wow. Join hands with us as we reach a hand in need. That's the mission of Fundación Manos Juntas, without which it would have been impossible to do our mission work.
In 1994, when I came down here, I was really apprehensive. And once I met the people here, I decided I had to come back. In 1995, I had 4 trips here. In 1996, I had 3 trips here. In 1996, one of the groups had a little difficulty with each other, and so I decided to organize a foundation that would be secular and we would not be bound to any particular religious belief. So we are Fundación Manos Juntas and organized with 3 basic missions. One is to make these trips to Nicaragua. 2 is to have a scholarship program here in Nicaragua. And 3 is to have a free clinic in Oklahoma City where we can meet the needs, the healthcare needs of the poor people there. One of the examples was a little girl who was maybe 10 years old, and she was so tall. And she came in, her mother said she's tired all the time. She can't run very far. She gets out of breath. So I listened to her heart, and when I listened to her heart, I could hear this funny murmur. And I listened to it again, and pretty soon I decided without any question that she had a patent ductus arteriosus. That basically is something that's totally curable with surgery. And it's relatively simple surgery. It's a surgery that I could do myself if I had to. And yet it is heart surgery. So it's a very serious thing. We had a nurse who was volunteering with us from the community, and she was helping us with our group. So I called her and I said, we've got to get this kid to the hospital for surgery. And this was on a Thursday or Friday, and the following Wednesday, she had her surgery and was, of course, cured completely. A year later, I'm back in that same community, and this young woman comes up. She's now this tall. She comes up, and when she comes up from me, she lifts her blouse up like this to show me her surgical incision. It was a real thrill to see that success. This is something that I personally feel, I think it's really, really, really ideal for doctors, nurses, PAs, nurse practitioners, everybody to be exposed to. Because in Oklahoma, and I suspect in South Dakota, we write prescriptions, hand them to the patients. The patients leave our office and say, thank you, doctor, and they go and they do not cash that prescription in because it costs too much money. And down here, it's the same kind of thing. So we can talk about helping, but if we don't actually provide the medication, it doesn't happen. And I think this is a very good educational thing for doctors to see as they're in school, because it will allow them to appreciate that their patients are in a different level of financial management. And so we have to modify our treatment programs. If we simply write the prescription for the newest, latest, most expensive medication, you're just mostly whistling in the dark. The patients are not going to take that medication. And so when you see them again and they're not any better, you blame the patients. Well, that's a horrible thing to do. And I think this kind of experience down here gets us away from that kind of thinking. I think we start to appreciate what people have to go through to get health care. Even though it's modest health care, it's very valuable.
Welcome back. I'm here with Shivon Barwari and Jaelin Otta, who are also students who had the experience of going to Nicaragua. Shivon, tell us a little bit about from where you come. What's your background?
I grew up in Sioux Falls, South Dakota, and right now I am a junior SDSU, biology, pre-med, and nutrition food science.
Oh, nutrition food science.
Yep. Hopefully in medical school I could go into more nutrition research, just kind of like an untapped field.
Right.
Something I'll go into.
Good. And Jaelin, you're from where originally?
I am from Sioux Falls as well. Me and Shivon grew up together.
So you
basically,
knew each other,
yes.
is that right? You knew each other?
So
For life.
we're pretty much stuck together at this point. So yeah, I was in Sioux Falls as well, and I'm a biology pre-medicine student and a junior.
And what year? Two juniors.
Both juniors.
We're the same.
Yeah.
We're essentially the same person.
Yeah, there you are. You're the same people. So tell us a little bit about what brought you to go to this country. I mean, this mission trip it's kind of throws you out of your normal deal.
Well, me and Shivon, our freshman year, actually, we had the experience of going to China and Taiwan for a month.
Oh, what was that?
We was also a health-based nutrition science learning experience where we kind of learned about their healthcare system, their nutrition aspects in the countries of Taiwan and China.
Oh, wow.
And since we do everything together, we decided that talk with you and Joanie and the Manos Juntos Foundation, going to Nicaragua is kind of the next step in the journey to kind of a global perspective on health and access to care and nutrition and things like that.
Yeah.
We heard about the trip and asked Jaelin, do you want to go on another adventure this year?
Yeah.
Like,
Try another
might as well.
adventure? Might as well. So you had a chance to expect probably something similar to China. Was it anything like your Chinese experience?
No.
Not at all.
It was very different.
Yeah, how so?
Well, in Nicaragua, we were doing more of like volunteer work, like healthcare and all that, just going around rural areas, whereas in China, everything was beyond urban.
Yeah,
there's no
there's
rural.
rural, but it's like it's either city or it's not
Outside of the
city
city.
because you can't physically put a building on this mountain anymore.
Yeah.
One unique thing is we did a lot of focus on traditional Chinese medicine, which couldn't do in Nicaragua
Right.
for obvious reasons, but that was a new perspective, just looking rather than, just everything very scientific and just research. There's just old remedies that would have similar effects that we have today.
Right. What did you expect from this experience in Nicaragua, though? I mean, did you think it was going to be something that it wasn't, or what did you expect?
I guess I really didn't know much about or what to expect seeing going in. I mean, what you get from the internet never really does it justice. So hearing the term like a third world country, relatively impoverished, a nation focused on agriculture, you can kind of form an idea, but you don't really know until you get in the country. And so I guess my interpretations were kind of changing as we went through the trip. And especially the country's topographical and environmental features are so vastly different from what the United States can do, from just rainforest mountains to volcanoes and then big plains, all within 200-300 miles where you can have everything. It's quite a bit different than the Midwest, where we can see Fargo from here almost.
Yeah.
So.
We can almost see Fargo from here, yeah. So what did you do day to day? Let's hear that.
So when we went to each site to do our work, essentially we were either a pharmacist, a physician, or an entertainer. And when I say that, as a pharmacist, we would set up like all the medicine, and we would like get a prescription from a physician, and we would just find the correct medication and give it to the patient. As a physician, we would sit in and shadow with Dr. Shook or Dr. Holm, and we would just listen to them, hear the symptoms the patient would have, and just prescribe them. And as an entertainer, I mean, when everyone's busy, there's a bunch of kids just waiting around, so we whip out a soccer ball or a frisbee, just have fun with them, just
Entertain
yeah.
the kids.
One thing is universal
Pastime.
is that kids will tire you out, I think, no matter what country you're in. And they were much better with the soccer ball than we were.
Oh, is that right?
Yes.
So I want to hear a little bit more about Dr. Shook. And you said there was another doctor, Dr. who?
Dr. Holm.
Holm?
Or yeah, there was another
Dr.
female
Holm.
Dr. Holm, I believe.
Yeah. So, but let's hear about Dr. Shook. He's kind of been a hero of mine for many years, and he was, I met him in a leadership role in the American Society of Internal Medicine before it joined with the American College of Physicians, and because of him, they made tremendous changes. I mean, he was truly my hero, and he became my friend. And he was on the show 3 years ago, and we learned about his project in Nicaragua, and that's how it happened. But, and so tell me a little bit about what you thought of him.
Great guy. He has so many stories of just everything he's done in the past. It's kind of inspirational. Just all the work he's done, everything he's seen, and doing this, just out of his own time. He had his full-time job in Oklahoma, and then he went 3-4 times a year to Nicaragua. It's something you want to do yourself. Just like, I could be that like outreaching and touching for other people's lives.
Yeah, I don't think he's making money doing this.
No.
He's really more of like a larger-than-life character, almost like a caricature of like a physician could be. It's just, you're like, oh, what else do you do? And it's, of course, he does even worse. You're like, how do you find the time? And he's like, well, I find the time in between this other thing that I do. And you're like, where? How? Do you sleep? I don't know.
How old are you?
Yeah, it's just all the giving and being able to keep up with us, and sometimes beyond us even, and just the motivation and inspiration that he brought to the experience on the trip was really enlightening and kind of furthering, developing probably why we aspire to be physicians ourselves.
And with
Yes.
Yeah, of course.
there you go. This is another layer of heroes, of people looking at him as a hero. What did you do on a day-to-day basis, though? I mean, you went out to different farms and different rural areas, I presume, and provided mostly pharmaceutical business?
Yeah, so I guess in the morning, it would be just a fairly standard like continental breakfast, juice, toast, locally sourced fruit, and then coffee. And we'd usually all pile in the vans, drive off to a rural location in a building. It seemed to be usually like community rec centers, churches, something else of that nature, where we would just kind of take whatever was available to us, a table. There was one point where we had what seemed like they would just be like stilts for painting, I believe, and we'd like put pieces of styrofoam over the top to work as a table to operate a pharmacy. It was very resourceful based, working with community members to try to set up something from nothing. And then you would just kind of get all the pharmaceuticals out, organize them the best you could, and then try to manage chaos for about 3 hours as
We managed to
people
get it pretty
run out.
efficient. Just going in, I remember getting a new prescription. It got to a point like probably as short as like 10, 15 seconds, order ready. And then we just, all the
You'd bring them
medication.
the medicine.
The stereotype of doctor's handwriting was learned to be true very shortly, unfortunately. It was, you always hear about it and you're like, come on, it can't be that bad. But after the first prescription, you're like,
Doctor,
I don't even know what that starts
We
with.
need to go back and read this.
Eventually, there was some that was quite literally like 3 scribbles in a line, and you're,
what?
oh, of course, that's albuterol. You're, there's only like 4 letters here. How did you get that?
So you did learn pharmacy, though. This was an experience to learn pharmaceutical things as well, and and you treated people with asthma. What other illnesses did you see?
Let's see, asthma, fevers. We did have some medication that dealt with parasites, because there's a big issue with like the water infection, like just infestation of various bacteria, parasites, viruses. So we had a lot of medications like that on hand. It was really kind of interesting to learn, just because we don't have those things in South Dakota. So more medicine.
And did you find illness yourself? Was there an experience that you had when you got there? I mean,
Yeah, unfortunately. They always warn you about not drinking the water, and so we were really good about that. But there's the water, and then there's kind of a slew of other things that you aren't really informed about that maybe you should stay away from.
Like
and we had one experience in a village where we had set up, and the locals had come out, and it was kind of often to repay the kindness that they were doing, they would provide a meal of some sort that they could do. And they had brought in a jug of juice that we imagine was freshly squeezed fruit from the area. It kind of tasted like cantaloupe. And we drank it. It was really, really good. You could tell it was fresh, and it was really refreshing. And afterwards, we were sitting there, and Dr. Shook, just kind of out of nowhere in the corner, we probably shouldn't have drank that. And we're like, drank what? Well, the juice. I have to imagine that was washed with the local well water.
yeah.
And well, I mean,
The great hospitality. You can't just say no, thank you.
No,
I don't
how do
want
you
to
say
drink
no
that.
to that fabulous juice? But
It was a good drink too. So
it was good.
But
was
you,
worth it.
but you ended up with a parasitic infection yourself, is what I hear.
Yeah, a few of us were a little bit unfortunate that we had to battle. I was lucky enough not to, but Shivon did kind of ride that rocky
it
road
was
for
a
the rest of
rough
the
roller
trip.
coaster all the way back to the States. I didn't even have the worst of it too.
Yeah, there were others who did
Awful.
pretty bad.
Juice was worth it, I think, still.
Well,
overall,
it's the
but-
memory. It's the memory, and of course you said thank you.
Yes.
Oh, of
You
course.
don't pretend to be drinking it. Tell me the hardest part of the whole trip.
The mountain.
That's the mountain. The mountain, climbing a mountain.
Yeah.
I heard there was a late night, and everybody was a little nervous about you coming back.
Well, we are college students, and we like to, adventure and just have our own little shenanigans. And one of our activities, this was probably 3 hours before we had to go down for dinner. So we were at a little resort, and there was a mountain in our backyard. So we decided we're going to go climb it.
And they said you could.
Yes.
Yeah.
And a little aside before the mountain, when we got back, actually, I turned on cable TV and the show Naked and Afraid was on.
Is that what's the show?
Naked and Afraid. For some reason, they just strip the people and throw them out in the wilderness to see if they can survive.
Naked and Afraid.
And this episode was in the exact same location that we were in.
No kidding.
The Nicaraguan mountainous rainforest, where they were a survival test for 3 days.
You didn't see any naked people, though.
We didn't.
Fortunately, and there were just all these facts about the poisonous animals and things that we were encountering, and I was sitting there and I was like, my goodness, how we ever managed to get through.
And they said all sunlight is lost at 5:30, and we look at our phones, it's 7 o'clock, and it's just darkness. We have 10 college students on their phones, flashlight, just trying to navigate downhill.
Trying to get back. So I think that
It was a good
Boyd was a
bonding
little
experience,
nervous. I heard.
for sure.
Well, so that was the toughest. What was the greatest experience?
I would probably just say the culture shock and just seeing the world in a different perspective. I mean, a third world country, it's very different in South Dakota, just first world, United States. Just going in, seeing the people in need and being able to offer a service that they normally wouldn't get, or they would have to wait months longer to receive. Because a lot of them, they're able to receive treatments, like with their healthcare system, they're able to afford the treatment, or like do an operation. However, the post-treatment medication is what gets to them they can't afford. So a lot of the times, just if you don't get the post-treatment medication, it's not worth getting the treatment in the first place, because that will just cause far more problems down the road. So going in there and just giving that extra helping hand, just going in and here's like some medications for parasites, cough, fever, even vitamins, just anything simple, anything we could do, and seeing the look of gratitude on their eyes, just gracias and all of that. It was really worth
Yes,
it.
they were
great,
really,
Jaelin.
really appreciative.
Was that your part? What were your words on the greatest part of it?
I would say the greatest part really was just experiencing the culture for yourself, that other people's words really can't do justice for you, and just learning about the world more, becoming a better human being in the process, with a bigger global issue, and appreciation for what you have here. Like Shivon had said, the access to healthcare rurally is extremely limited. The cities have access, but they focus more on preventative treatment and screening. And so a lot of the patients, even rurally, have these numbers, but no means to fix any of them. And it was kind of often that Dr. Shook wasn't exactly always agreeing with, but providing like statin drugs to lower blood pressure, because there's no long-term treatment to gain the benefit of it, but it just makes them feel better when they're presented with a number of high blood pressure, but they can't ever do anything to afford the medication, just for maybe a week or two of relief mentally, if not a little bit physically, I think was one of the bigger aspects that I kind of gained of it.
Get in there and give them a sense that you care.
Yes, definitely.
Well, we really do appreciate you guys doing that and sharing your stories with us today. Often we take for granted the healthcare system we have in the United States, but to understand how lucky we are, sometimes we need a little perspective.
Puede haber una prioridad en la comunidad, ¿verdad? Donde vivimos.
Our community needs many things, mainly like building roads to drive ourselves to places. For example, this permanent care center, because if I become sick today, I can spend a month recovering, and then by the next month, I'm back to being sick again. And if no medical care is available during this month, I'll have to travel a ways, and for that reason, we concern ourselves with having a care center close by. And the rest is the economic crisis of our country, and those who suffer most are us who are in poor economic standing, who live with the situation of lacking employment. A low wage then limits us from living as one should live, such as with necessary things.
Mi problema que yo tuve hace 14 años era...
I had an enlarged thyroid gland. I was very tired, short of breath. I was fatigued, and I was gaining too much weight, and my thyroid continued to get larger. In less than 4 months, I gained 70 kilograms.
Me escapaba de hogar.
5 years later, I had cancer in the right breast. I found a little bump in the right breast, and I saw a doctor who ordered a mammogram. They found the tumor and did a biopsy. I had to sell a lot of my things and my home to pay for the chemotherapy. The first one was very painful. Lost my hair, my nails became dark, I had a lot of vomiting, and I became depressed. Then I had the surgery. The chemotherapy did work, reducing the tumor, but now we need to take it out after 8 sessions of chemotherapy. But I am very positive about my disease and the scar I got. I'm feeling good right now, and my biggest positive thoughts are my health and the love I can give to my children.
Well, we're back. Thank you for that wonderful experience that we saw. And now we have with us as a guest, Allie Fink, and again, Joanie. Let's talk to Allie a bit about where you're from.
I'm from Fargo, North Dakota. I've been living there for the past couple years. I was originally born in Kansas,
So, and then you came to SDSU because?
It kind of like fit best for what I wanted to do without it being like too far away from home, because obviously there's NDSU up in Fargo, but like their pre-med program's not the best. And so coming to SDSU, I toured it and I just really fell in love with the campus.
So what year are you?
I'm a sophomore.
So a sophomore in pre-med.
Mm-hmm.
And biology, I presume?
Yeah,
or
and I have a double major in global studies as well.
Global studies.
Mm-hmm.
So have you been to other countries before this?
I've been to Canada, but other than that, nothing really.
Canada.
Mm-hmm.
Yeah, that's probably, it's up near north of North Dakota.
Yeah, it was a school field trip,
Yeah.
so it's not like it was anything too great.
So now you've been to Nicaragua.
Yes.
So wow, that was great. Let's hear a little bit about your why you went there. I mean, what was your expectation? What was your hope?
I expected to like gain just kind of a better perspective of like healthcare in a third world country, and it's always been like an interest of mine to like expand and like help people with like global healthcare instead of just like in the United States. So going to Nicaragua, it was kind of like just an eye-opening experience to see like the need that they were in.
Right, so that was your expectation. Was that what you experienced?
Yeah, and I definitely saw like how much they need people down there to like help them, and organizations that Dr. Shook has and everything, and how much they do help those people down there. So
you sensed that there was a value to what you did as well?
Yes, definitely.
So what did you do mostly in your day-to-day experience? The pharmacy part?
We handed out a lot of medications, yeah, in the pharmacy part. It was really nice when you got to shadow some of the doctors and you would just sit in and you would listen to them. And I remember one time with Dr. Shook, I was sitting with him and he's like, okay, I'm going to give you the symptoms of this patient and like tell me what you think it is, because obviously they were speaking Spanish, so I didn't understand what they were saying at the time. And afterwards he's like, okay, this is what they had and they complained of like these symptoms. He's like, what do you think it is? And I was like, I don't know, is it parasites? And he's like, yeah, that's exactly what it is. And then he's like, this is how you can treat it. I think there was 2 different kinds of medications that they would use to treat it. And so I thought that was one of the more fun parts.
So one of the things that we had on this trip was the advantage of an interpreter. Tell us a little bit about your niece.
Well,
Joanie.
she is right now studying in Chile, which is interesting. She's fluent in Spanish. She's a sophomore music theater student, but has that Spanish background, so she was very helpful to us.
How did she learn that? I guess being in
She's from Florida.
Florida, and there's
so
a lot of Spanish speakers
She
there.
just started early in school and kept going. So she probably had 4 years in before she went to college, and then continued in college.
So Nicole Ketledge. Tell us a little bit about how she did. What was her experience, do you think?
Well, she was great benefit to us.
Yeah.
So she was busy because the providers and each needed an interpreter with them, and there were about 5 of us who were seeing patients.
This is Boyd. You were seeing peds.
I was seeing patients.
There's another.
There were 2 pediatricians and then Dr. Daisy. Yep. So what is that, 5? And so each of us had a table where we were set up, and they would bring the patients in, and we'd each have an interpreter so that we could hear the symptoms. And they would basically tell us the symptoms. I would still examine the child, looking at ears and throats, although really that wasn't terribly necessary. I'd still listen to hearts and so on, but some of the other providers, Dr. Shook, often would just hear the story and give them the medication, because he had been there and experienced so many times that the handful of problems that they had. I did see a woman with malaria, and that was the first time I'd ever seen that. And
active malaria with the
yes,
sweat.
and so, right, and I didn't know. I had to go ask Dr. Shook you know, okay, I've got these symptoms, and he said, malaria, treat her.
Malaria treatment.
We had malaria
Wow.
treatment. So.
And I remember like some of the symptoms that they would say. Dr. Shook knew kind of like their language for how they would word their symptoms, because like something that like we would never get, because they say their skin was like itchy, or they're like, there's things crawling inside my skin, and he automatically knew, oh, they're talking about the parasites. Whereas like we would sit and like wonder, be like, well, what do you mean by that? But he's been there so many times, he would understand them. Like as soon as they would say like, oh, this is what it feels like, he's like, okay, I know what this is. So.
It's the history. You know, it's no question about it. They say that 85% of all diagnosis is from the history, 10% is from the exam, and 5% from those fancy tests that we have, that we too much accentuate in this country now.
We certainly lived that in Nicaragua.
Yeah.
The history was the important aspect.
It's the only thing we had to go by, really. Didn't really have any tests to do.
Let's talk about the systems that they have there compared to the systems that we have. I mean, in the U.S. Could you
Healthcare?
Yeah, the healthcare systems.
Well, we didn't get to see in the city what they had.
We didn't really see like the public healthcare system. We didn't go into any like of the major hospitals and like experience any of that. It was very like
But you
rural.
saw the rural.
Yeah, we definitely
So what
saw
kind
the
of
rural.
system did they have there? Nothing.
Nothing.
Yep.
Yeah.
Like sometimes they would come in with a sheet of paper which had like a test result on it, so they knew what they had, but they couldn't afford to buy the medication. So like they had gone in and gotten the test done, but then they came for us for the medication.
Some of the businesses that hired folks would have health care. What was that last place we went, like a winery?
Oh, it was
Coffee company.
yeah, it was some coffee
yes.
plantation.
So they had health care there. And so they
hired doctor or a hired?
I think it was a nurse.
They had a nurse there.
And so, like, there was a lot of physical accidents that happened with the coffee cutting, with the machetes. And so they had some benefit of having some staff there. And at the plantation that we talked about, that we stayed at, they brought in health care to their workers. So we had a clinic at the facility where we stayed, because they had a staff of. And that was a coffee place as well, and they had a large staff. So
they normally had a nurse there most of the time. And
now the children were immunized, so they have a public health system.
That's very interesting.
There's a public health system of some kind. I think nurses go to the rural villages and give the immunizations.
Yep.
So Allie, I mean, you know, you looked at that experience, you know, and people could argue, well, what great good did we really do? But it really did something to you. And I would ask, you know, that's what we all think about our experiences most of the time. You know, we try to do the good thing, but really what happened was I changed.
Yeah.
Tell me a little bit about how might you have changed.
It definitely made me want to go into like global healthcare a lot more, because I realized I don't think enough is like being done for these people, and like what Dr. Shook is like wonderful and amazing, and I think there should be more doctors who are willing to like give so much to organizations like this. And so it made me really want to like change how I viewed I would practice medicine in the future. It made me want to focus more on the people who really, really need it.
So tell me a little bit more about Función Los Manos, Fundación Manos Juntas. Do you know much about the organization?
I don't know too terribly much about it, just like what Dr. Shook would tell us. I know that he puts his own money into it. They don't like raise a lot of money, and like it's his own money that buys the medications that goes down to the trip. He said it was like $10,000 worth of medications and everything, and I think it's a really great thing. I know he's been going down for a while too, so.
It's probably worth mentioning that the students, well, everyone who went paid their own way. So this wasn't something that was funded by Healing
Anybody
Words or no.
Yeah,
the students had to come up with the money
To travel. How much was a flight?
I don't know, I don't remember the details. It was $2,000 each, but that paid for our housing, and I'm sure it contributed to the medications. And so what, you know, part of what we gave is to help purchase the medications.
Right, and that's what he did. I'm sure he knew what kind of medicines to bring.
Oh, right. He's done this so long.
So much.
And then we did have a Nicaraguan doctor that Dr. Shook has gotten to know, and so Dr. Daisy was part of it, and so she was very valuable in I think the setup of all the villages. Although Dr. Shook goes to villages all the time, they choose different villages, so she was able to
set up the villages,
help communicate ahead of time. The people obviously knew we were coming. They were waiting for
They
us.
know who Dr. Shook is, which I thought was like amazing. They
Yeah.
like almost like everyone like in the country knew who he was. We got on a plane to leave and they knew him by his name.
The
And
airplane people.
Yep. They're like, "Thank you so much for your work, Dr. Shook." And he's like, "Yeah, that happens." And I was
And of
like,
course, Dr. Daisy, she always said, Dr. Chook, Dr.
"Yep,
Chook.
yep," because of her accent.
It's so cute.
No, it's just like amazing how much that everybody just knew who he was and how respected he was in the country. And
How would people
love it.
connect? If you Googled Boyd Shook, or if you Googled Fundación
Juntos.
Manos Juntos,
You would find it. He has a website. And
I think maybe we should have that internet site up.
And we do.
Before actually, you can go to our internet site, On Call with the Prairie Doc, or prairiedoc.org, and you can look it up and then jump on board and find out about how you might be interested in contributing. If you don't contribute by your heart and your soul and your body and/or your grandchildren, that you could contribute perhaps financially. So that would be a wonderful thing to do. So let's talk about dental hygiene. I know that there's been issues about teeth there. What was that story?
I was going to bring that story up a minute ago when we were talking about how the children were so appreciative. Earlier we were talking about the ball and playing. Well, they were so appreciative of the toothbrushes. We brought quite a few, and I would be at my table and I'd be seeing kids, and other little kids would come up that were seeing another provider, and they'd come up and tap on me, and because they wanted a toothbrush. And that was a great treat to get a toothbrush. And then the moms often would come over and in broken Spanish ask if they could have one too, because I was predominantly saving them for the kids, but we were happy to give them away. We could have brought a lot more, and dental care is a weak area in all of the developing countries that I've been to.
Yeah.
And it's unfortunate that because there are systemic illnesses that poor dental care contributes to.
Well, and I wonder, proper water hygiene, boiling the water and preventing illnesses from dirty water.
I feel as though they have like so many like other things that they're worrying about that it just kind of gets pushed to the side without realizing like what big problems can come from not having good dental hygiene. Like they can have like horrible sores in their mouth and like horrible pain, and it's just not their top priority, which.
And do you think they ate well? I mean, did they have good nutrition, speaking of boiled water and stuff like that?
Wasn't the best.
I think they were. Well, I'm guessing.
tried.
I think they filled up, but it was a lot of beans and rice.
Yeah, which isn't a good nutrition. It doesn't give you all the vitamins that you need, and so.
It isn't a balanced diet, although it has the main essential proteins, the amino acid, the 13 essential amino acids. It was the beans and the rice, a vegetarian diet that has the balance for the protein.
I think Dr. Shook talked a lot about the higher rice level, though, which didn't have the nutrients.
what?
The rice. They had more rice than they had the beans.
A lot about
he talked
how
a lot
he's
about
like, they
the rice.
shouldn't be eating the rice. He's like, it's just, it makes them full, but it doesn't give them anything that they need.
What about, was it brown rice or was it polished rice where it lost the
It was
nutritional?
white rice, yeah.
It's white polished rice, so they didn't even have the brown elements
Yeah,
of the
it
rice.
wasn't even.
There were some fruits and vegetables that we got to eat, but I think they set the table pretty high for us.
Yeah.
They wanted to thank us, and so we had plantains and
There was
some other fruits.
One day we got like avocados and tomatoes, and I was like, wow, this is such like a nice thing that we get. We haven't had this, and so. And it's like, I don't think they would normally eat something like that. It was just like a thank you gesture to us that they gave it to us.
When we were in China, that's kind of what happened with us. We didn't get their normal food. We got their banquet food.
Yeah.
So they appreciated what you did. They really did.
And the women of the village, or men and women of the village, but mainly the women cooked those meals and came and brought it to us. So they had a lot of pride in
Giving
setting up.
Yes, you could tell like they enjoyed serving us and like giving us the food, and whatever we couldn't eat we would give to the kids, because we're like, well, we don't want to throw it away and be rude, because obviously food is so hard for them to come by. And so it was like, well, even if we're full, we'll just give it to the kids, and they loved that. They greatly appreciated that.
And it's a thank you to them for providing you that wonderful food. And now for the answer for this week's Prairie Doc quiz question. The percentage of the Nicaraguan population that's over the age of 65, A, 20%, B, 10%, C, less than 5%. The correct answer is C, less than 5% is over the age of 65. The majority of the Nicaraguan population is under 34. In comparison, in the United States, 15% of the population is over the age of 65. And as you can see in this graphic, the population is consistently healthy here until about age 65, and then it takes off in that pyramid. It's totally different than the Nicaraguan picture. We'll be right back after this.
As your baby grows, there are new surprises and adventures every day. With each new milestone, remember, immunizations are safe and one of the best ways to protect against serious diseases, especially between birth and age 5.
Now that my grandson Henry has reached his first birthday and our granddaughter Stella has arrived, we're making sure that they stay on their immunization schedules.
Schedule your children's immunizations today, for baby's sake.
Is there a value to a foreign medical trip? I think that SDSU students who traveled to Nicaragua in the summer of 2015 would say yes. Dr. Boyd Shook, an American physician who has worked in Nicaragua for many years, led our group. This caring, loving man demonstrated respect for people of all ages and levels of health and economic background. Our group was able to provide support as Dr. Shook and other care providers saw patients. All of our hands were needed to set up the rural clinic, see the patients, provide medications, and pack up for a move to another location. In the rural places we visited, people did not have easy access to care. The medications we provided helped many who suffer from parasitic infections that cause chronic abdominal pain and diarrhea. The simple vitamins provided helped those who could not afford a balanced diet. Did we save lives? Probably not. Did we make a difference? Yes. There were other advantages to this trip as well. Along with the modest benefits to the Nicaraguans, our participants were able to see another part of this incredible world. Travel to new places has a way of broadening horizons. It often feels as if people from faraway places are just not so different when you meet them one-on-one. In a way, the world seems smaller when one can see people have many similarities despite their locations and surroundings. It may be difficult to quantitate the financial value of a foreign medical trip. It is not so difficult to measure the satisfaction one feels in the heart.
I want to thank all of our fantastic guests tonight. Behind me are just some of the many more students who went on the medical mission trip to Nicaragua. To see all the photos from the trip to Nicaragua, visit our website, prairiedoc.org. Go there, see those pictures. We also want to take a moment to thank our first ever graduated Prairie Doc assistant, Sarah Erickson. Sarah is working as a medical scribe in an orthopedic clinic and volunteering in an emergency room department in Minneapolis. So she was a very hard worker. We want to say thank you. She was a driving force in our Prairie Doc assistantship program. Well, that does it for us tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people. Whoopee-doo! Hey, hey, hey.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
And by
the South Dakota Foundation for Medical Care, an organization working with the state's healthcare community to provide quality of care as part of the Great Plains Quality Innovation Network.
Additional funding is provided by
Aberdeen Asthma and Allergy,
Avera Heart Hospital,
Brookings Health System,
Dakota Allergy and Asthma,
Dakota Care,
Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee,
South Dakota State Medical Association,
Swiftel Communications.
and Vance Thompson Vision.
Closed captioning for On Call with the Prairie Doc is provided by
Avera
Brookings Health System,
and Fishback Financial Corporation.